Now, this is a very interesting X-ray that we'll be discussing today. Now, if you can simply think of what these X-ray has in its finding, then we can have a discussion or we can have something which is very, very interesting in this chest X-ray. Now, this is a chest X-ray that is in PA view, as we can see it here, that it is in the PA view. So, the obviously this is the left side, this is the right side, this is labeled as R. Now what we can see, this is all the lung field, which you can very clearly make out. Now in here, the angle is completely clear, so there is no effusion. And most of the time, if the patient has heart failure, we can always think of effusion. Now this side of angle is not very well visible because there are so much of the irregularities in here. Now, the other things which we can very clearly see that, so there is no right side diffusion. If you can see, this is the upper border of the lung, which we can see in here. This is the lower border, this lowest border. Here we can see it is here. So this vertical distance is much more in the right lung, as well as this transverse distance is also much more here, because here we can see this is all heart, this is up to heart is shifted to the left side. So the lung is much more reduced on the left side, which is apparently like that, because lung means lung is actually a translucent or kind of a blackish structure. So this is all lung, which is very, very well visible here, but here it is not. Now the one of the most important thing for a chest X-ray is trachea. Now where is the trachea? As we can see clearly, this is the trachea. If we can see in here, this is the trachea. So this is the trachea, which is completely shifted to the left side. Now, as this is the midline, the trachea should have been like here in this midline, but it is completely shifted to the left side. So we very well know that in lung pathology, effusion pushes the trachea, a tumor, mass, or solid structure pushes the trachea, whereas fibrosis, restrictive lung diseases where there is shrinking of the lung parenchyma, they pull the trachea towards the affected side. So fibrosis, restrictive lung diseases, or anything that shrinks the lungs will simply pull the trachea towards that particular side. So this is obviously trachea is completely shifted toward the left side. It means that there is either significant restriction toward the left side of the lung or fibrosis of the lung field. Now, what we can see is there are multiple very dark white linear margins or linear fibrotic bands which are there. So there are so many. If you zoom in, you can see this is the fibrotic line, this is a fibrotic line, this is a dense white, because fibrosis appears dense white. So if you can see here, if you can see in here, so this dense white fibrotic lines are there. These all indicate that there is fibrosis. There is all fibrosis. Fibrosis indicates a lung parenchyma damage that is not resolved, that is actually complicated by fibrosis. Anytime when the lung gets damaged, it should completely recover to its original size, shape, consistency, integrity, or if it gets complicated, it will go into favor of fibrosis. Now, as we can see, there are so many dense white fibrotic structures or fibrotic lines spread all over the left lung parenchyma. From here to here, there are so many fibrotic, thick, white streaks which are present all over the lung, which simply causes fibrosis. So, if the lung was like this, because of the fibrosis, the lung get shrunken, the lung get small, the lungs get fibrotic, and that is what is a restrictive restrictive lung disease, where there is restriction to the lung expansion. So lung cannot expand, lung cannot deflate, or lung cannot inflate because it is significantly damaged. The lung has to be a sponge-like, soft and compliant. But if there is so much of fibrosis, lung cannot expand, lung cannot inflate. That is the reason why there will be persistent poor oxygenation, and the person will definitely have shortness of breath, because if lungs are good, lungs are compliant, then only the oxygenation will be there, then only the patient will not have shortness of breath. So in this case, the patient had chronic bronchiectasis, that too with cystic chronic bronchiectasis. So the patient had extensive lung damages with extensive chronic and cystic bronchiectasis, which involved not only the alveoli but the bronchi, the terminal bronchi, and the significant portion of the respiratory tract. So that was the reason the patient had multiple cystic bronchiectasis because of the old infections, which was not healed properly, which was not treated properly, which led to significant cystic chronic bronchiectasis. Now, this bronchiectasis can be very, very well seen on CT scan of the chest. I do have the CT scan chest of this patient, and I'll definitely make a video on it. But on this, what we can understand is there is significant loss of lung parenchyma on the left side, causing left-sided significant restrictive lung disease, fibrosis, causing pulling of the trachea towards the ipsilateral left side, which actually causes compensatory emphysema of the right side. That is the reason why there is over expansion of this right side of the lung to compensate for oxygenation. So that is the reason why the right-sided lung parenchyma appears much more translucent, and it appears overinflated compared to the normal left side. Now we can very easily see that whenever we are talking about restriction or emphysematous changes, we always have to see the inter rib distance. So as you can see, this is the rib and this is the lower margin of the rib. So just see the distance between these two. It is so small. Same as like this. This is the upper margin of the rib. This is the lower margin of the upper rib. So this is the distance. So just compare this distance with this distance. So there is basically significantly reduced uh, inter inter rib distance. That is how we can come to know that this is overinflated and this is a restrictive lung disease. So this is a very interesting X-ray, and I will share the CT scan of the same patient, which shows very good chronic cystic bronchiectasis with significant restrictive lung disease with mediastinal as well as the tracheal shifting to the left side. Why mediastinal? Because we can see the some portion of the heart, especially right portion of some right atrium, right ventricle should have been here, but this is all the vertebral spine. We can see these vertebra. So the heart is not at all seen on the right side, so the heart is completely pushed toward the left side. So heart is a portion of mediastinum. As we can see, the trachea and heart border is around here. So the heart is completely pulled toward the left side. The trachea is completely pulled toward the left side because of the significant restrictive lung disease on the left side, significant fibrosis on of the left lung parenchyma. That's all for now, and thank you so much for watching.